Hello, this is Dr. Seth Jarrell. Today I want to talk to you about anxiety disorders. So there's a few different kinds. There is generalized anxiety disorder. There is just a regular old panic attacks. And then there's kind of a mixture of the two. So let's talk about generalized anxiety disorder first. So generalized anxiety disorder is a disorder where at a baseline level you're just more anxious than other people. You may feel restlessness. You may feel a warmth or a pressure in your chest. You may feel just this worry all the time that bad things are going to happen. And lots of people have issues with sleep. They can't go to sleep at night because things are running through their head. They wake up in the middle of the night and things are still running through their head. And that can be a complete cycle that makes the anxiety worse because you can't sleep. In order to have generalized anxiety disorder, it has to last over 6 months. Now let's also talk about panic attacks. Panic attacks are a little bit different. People may all of a sudden have this huge sense of doom come over them. They have a high amount of energy that comes over them. You may get short of breath, can't hardly breathe, can't catch yourself, have to breathe into a bag, have people calm you down. Now that's completely different. Those come in waves, and a lot of times they're associated with each other. When I talk about generalized anxiety disorder, one of the main things that I have people do is fill out something called a GAD-7 score, or a Generalized Anxiety Disorder 7 score. What it does is a questionnaire that you fill out, and you rank it from 0 to whatever score. And you answer the questions, and then we score it at the end. That's one of the best ways I can find to see the severity of your anxiety and then how well we're progressing after treatment. So we may start at a 20, and then the next time I see you, you're down to a 12. And that helps me know if we're progressing and how much we're progressing. So what is going on with anxiety? Well, I like to explain it like this. You have an area in your brain that is overactive. That area that deals with emotions. Let's just say that one of the areas is the amygdala, which is part of the brain. In that area, there is a signal that's going on. That signal is saying, be anxious. So when we were made, that was a very important signal to be made, because if you see a bear in the wild, your body needs to get a lot of energy at one time so that you can either fight or you can run away. That's called the fight or flight response. So down in the adrenal glands, your body makes a hormone called epinephrine. This is very simplistic terms. This is not really how, in a deep sense, how it works, but in a very simplified sense, it is. So the adrenal gland makes that epinephrine. That epinephrine then travels up through some connections up into the brain, tells the amygdala and some of the other areas of the brain that you need to be anxious. You need to dilate your pupils out so that you can see better. You need to tense your muscles up. You need to be able to run. You need to be able to fight. And that is a normal response. What happens in anxiety is that signal never gets turned completely off. So after you see a bear, about 20 minutes later, those signals should go down. So the brain sends a signal back down to the adrenal gland and says, you need to turn off. We're good now. In anxiety, it's a constant low level of that being turned on. And so we need to short circuit that. And there's some different ways that we can short circuit that. The number one way that I found is with medications. Lots of people do need medications for their anxiety. So there's a few different medications that we use for anxiety. Some of them are antidepressants known as SSRIs, or selective serotonin reuptake inhibitors. Now, the ones that are better for anxiety have more of an action on histamine, which can make you calm, can help with sleep, but that also can cause some weight gain. And so we usually try to do the ones that have less weight gaining properties, but they're usually less effective for anxiety. So sometimes it's trial and error. The other one is a medication that is called buspirone, or Buspar. Buspar is a great medication because it is just for anxiety for the most part. and it does not cause weight gain. Some people do get a little bit of jitteriness when they first started, and some people have some headaches when they first start, but those symptoms go away. Whenever we're starting any of these medications, the biggest issue is there's going to be some side effects, most likely. 10% of people have side effects, and they stop the medications because of that. Just know that the side effects almost always go away after 4 weeks. So if you're having side effects such as nausea, diarrhea, headaches, jitteriness, please let me know. If it's becoming unbearable, please do not stop the medication, because we got to get through those first 4 weeks. If you're having severe ones, we can change to a different one, but let me know. Just don't stop it on your own. If we can get past those first 4 weeks, usually goes away. The second thing is those medications don't take effect immediately. It takes time. There's no quick fix to generalized anxiety disorder, or depression for that matter. But for generalized anxiety disorder, those medications take at least 4 weeks to have some effect. And to get a full effect, it takes 6 weeks. So give it time. If you give it the time, we'll be able to tell if you have a response. If you have a response, we may go up on the medication. Or if you had a full response, we may just keep it where it's at. If you had no response, we start back at the drawing board and we try something else. But remember, there is no quick fix to this. Another thing is I really do not like benzodiazepines for anxiety. Those are things such as Valium, Klonopin, Xanax. Those short-term help, but they're very addictive, and they have abuse potential. And if you take too much of them, they cause your breathing to stop. So I encourage people, if you're already on those, let's try to come off of them. For panic attacks, those do seem to help when we first start. And sometimes we start and give a little bit of Klonopin in people, but eventually we get you controlled with something else. But for the most part, I do not prescribe that at all. Another option for panic attacks is something called hydroxyzine or Atarax. Now, the biggest issue with this is it can make you very sleepy right after you take it. Some people it doesn't. So if you're at work, it can be very difficult. But if you're having a panic attack at work, you're probably going to have to go home anyways. But that's another thing we can do until we get your anxiety controlled, is take one of those, wait about 30 minutes, and it's definitely going to kick in. Another important part of your anxiety is getting 8 to 9 hours of sleep a night. That means waking and rising near the same time every day, and using a sleep app to help you get there. So you say, I have anxiety, how am I supposed to sleep? We're going to get there with the medications. There's some things I can do, but you have to make it a priority to get in bed at a good time every night. You can add melatonin. Melatonin 3 to 5 milligrams, usually 3 hours before bedtime. If it makes you too sleepy before then take it 1 hour before bedtime. But that really can help with sleep. Another thing that can help is an app. There's an app called the Life Armor app. It was created by some psychiatrists. You can download it on your smartphone. It has some good breathing exercises for those with panic attacks, and it has some other good tools on it for those with generalized anxiety disorder. I suggest in everybody obtaining some support from friends and relatives, and clergy if necessary. So if you are a religious person, I think it's great to talk to someone in the pastoral council or your pastor. I always offer a referral to psychiatry if that is something that you want. That means for either psychotherapy, which is counseling, or for cognitive behavioral therapy, which is just retraining your brain how to think. If that's something you want to approach, let me know. If you'd rather not see a psychiatrist and you'd rather just see a counselor, we'll be happy to do that as well, and I think that's a good choice. Finally, I advise reading the books Your Brain at Work, which is a book by David Rock. It is a book about what is causing anxiety and some things you can retrain your brain how to deal with it when it comes across. I really like this book. I read it on, actually listened to it by audio. Really good resource, and it's a good way for you to deal with your anxiety. Another one is a book called Mindfulness. It's by Danny Penman and Mark Williams. It is more of a meditation type thing, and you can also, if you're religious, bring in prayer into it. But it helps you to calm down. It helps you to retrain your brain as well, how to deal with stressors in your life and how to keep that anxiety down at a baseline. If you don't want to do medications, this is a completely fine option. So, how do we go about visits for your anxiety? So, the first time we diagnose anxiety, You may or may not want to try medications. You may just want to do psychotherapy. You may want to do counseling, or you may want to do some cognitive behavioral therapy. You may just want to try some of the books that I mentioned. Regardless, I bring you back at 1 month. If we are on a medication, then we talk about the side effects, how we're doing with it, and then we do another GAD-7 score, and we see if we've improved. If we've improved, we're on the right track. May need to go up on the medication, may need to just give it more time. If we're where we need to be, we're where we need to be. If we haven't improved at all, we go back to the drawing board and we try something different. Do you need to be on medications the rest of your life? Maybe, maybe not. Some people at 6 months are fine. We try to wean off of it then. Some people at 1 year are fine. We try to wean off of it. If we can't, then we keep on it. The key is making sure that we keep up with this. So if you have anxiety, what I normally do is we start something, wait a month, come back. If we're doing well, we back it down to every 6 months. If we're not doing well, we come back in a month. Until we get it controlled, we come back every month. But once it's controlled, every 6 months is fine. So now that you know a little bit about anxiety, some of the things that you can do to help yourself, and some of the things we can do to help you, it's time to get on board with this. And it's going to be a long journey, but we're going to do this together. So if you need any help with it, please let me know. Thank you, and have a great day.